Hello, I am Dr. Vikas Gorhe, Gynecologist, Fertility and Laproscopic Surgeon, Nashik. Today I will be talking with you on a very different topic, that is diet after Cesarean section. Most of the women ask me this question, what we should eat after the Cesarean section. So friends, Cesarean section or a Cesarean operation usually happens or takes place when there is a problem in normal delivery process, and the causes are mainly problem in passage of the mother, then the passenger, that means the fetus position and presentation, and the mother's maternal condition. So if there are any unforeseen complication in all these three things, then we have to take the decision of Cesarean section. Whatever the delivery process is there, whether it is normal delivery or Cesarean, it is definitely a mentally and physically exhausting for the mother, and the whole 9-month period of the pregnancy is definitely stressful for that pregnant lady. So as far as the diet is concerned, the diet should be nutritious, balanced and rich in vitamins, so as to fulfill her three things. That is, first is that it should fulfill her requirement of breastfeeding to feed her newborn. Then it should be able to help her to recover from her major operation and for her wound healing process. Then if she takes this diet in a very proportionate manner in the form of carbohydrate, proteins, fats, vitamins and minerals, and if she takes in a perfect balanced manner, then she will definitely shed her gain weight during the whole 9 months. And if she, along with this diet, if she do the proper exercise program, then she will definitely reshape her to the non-pregnancy state as she was before. Let us see what kind of diet and dietary content should be there for the post-cesarean delivery patients or the women. This diet should be easily digestible and intestine friendly as far as the movement of the intestine is concerned. If this is easily digestible and having a good intestinal motility, then this female will not suffer from the constipation problem, and this constipation is the mostly observed problem for all post-delivery patients and the post-cesarean section delivery patients. So what are the causes mainly for these patients to have a constipation? First is the iron tablets, which is usually prescribed into the pregnancy and the post-delivery period to maintain the hemoglobin. That also causes the constipation. Then these women, by some or the other reason, drink less water and have a less liquid foods, so they remain dehydrated. Along with that, pregnancy state itself and post-delivery, because of episiotomy wound pain and the Cesarean section pain, these people have less tone for the abdominal muscles and pelvic floor muscle. That also causes the constipation. And along with that, there is some psychological factor for post-delivery patients. As far as the Cesarean section is concerned, they feel if they strain more for the stool process, then they will have a problem in wound healing process, or it will disturb their stitches. So these are the mainly causes for constipation. And few things if they follow, that means drinking lot of water, taking a food which is having a lot many fiber content, then taking a warm water and the warm fluid diet, that is in the form of warm soups or hot milk, then this constipation problem can be tackled. Second most important thing as far as the diet is concerned, that we have already mentioned in a previous part of this video, is that it should help her recovery and good wound healing, and for that diet should be nutritious, healthy and well balanced in the form of protein contents, then vitamin contents and mineral content. At the same time, it should fulfill her requirement of milk production for breastfeeding. Now let us see which are the things which are rich in calcium and proteins. Mainly the milk products, cheese, paneer, then butter, low-fat yogurts, then egg, meat, various pulses, beans, nuts. These are the rich sources of calcium and protein. Then there are few things which are also required, like rich in iron content and vitamins. Then green leafy vegetables, various red fruits, then various nuts, then jaggery, then beet, and other vegetable salads which are rich in iron and vitamins, which are mainly required for the maintenance of hemoglobin and maintenance of good immunity for her well-beingness and good wound healing after the cesarean section. Diet rich in fibers to avoid the constipation are mainly the whole grain breads and the food materials made from the whole grains like wheats, then brown rice, then oats, ragi, bajra, which are the rich sources of calcium, iron, protein and the fibers. Along with that, if you incorporate fresh fruits, then the raw vegetable which are clean and washed, which will also help in adding the fibers and the vitamin content. There are few of the Indian spices which are added into the mother's diet so as to have the speedy recovery and having a good sense of well-beingness are mainly, first thing is the hing, which is also called as asafoetida, which helps in her digestion and milk production. Then jeera, which also helps in milk production and digestion. Mainly the hing or asafoetida helps in ease out her gas and flatulence problem, which is the most commonly faced problem for the mothers after the delivery or the post-cesarean. Then the third important thing is ova, or which is also called as ajwain or carom seed, which helps her in digestion, and if it transferred to the baby from her milk, the baby's bowel movement or intestinal movements are also regulated and it helps baby for good digestion. Then which are the foods which should be avoided by the post-delivery pregnant ladies or the post-cesarean section women are mainly the deep fried or the spicy food should be avoided, which causes unnecessary heartburns and the bloating. Then there are some carbonated drinks, then caffeine, alcohol should be avoided, then cold and uncooked food and the fast food should be avoided. Then the most important thing, the dietary content which produces the gas while digestion, like urid dal, then chana, then rajma, chauli, besan, which increases the gas production while digestion and which causes her bloating, and she feels that because of bloating and big distension her stitches might get disturbed. So these dietary content should be avoided as per as the diet of post-cesarean women is concerned. Along with this good nutritious dietary content which are mentioned earlier in this video, mother should have a adequate rest for recovering from this major operation and post-cesarean delivery. For that, she should take a nice and good sleep as and when she gets the time from her feeding child. At the same time, with this dietary advice or this dietary consumption, she should start doing the non-strenuous gentle exercise day by day, increasing gradually so as to become like a pre-pregnancy state as she was before. Exercise after cesarean section will be explained in next video on YouTube. For that, please log on to the YouTube. If you have any query on this subject, please feel free to contact on our phone. If you like our channel, subscribe it, like it, share it. See you in next video for some other topic on women's health. Thank you very much.